how is lip enhancement done for people in their late 30s and 40s?
One of the most characteristic features for someone in their 20s and early 30s is having full and well-defined lips. This doesn't mean that the exaggerated lips of so-called influencers is the new normal. Not at all. Even if thin lips run in your family, there is no debating what the youthful appearance of your lips look like in your 20s and early 30s. The lips are an important part of both verbal and nonverbal communication. It's well established people tend to focus their gaze on an upside-down triangle of the face, focusing on the eyes, nose, and lips. I see a lot of people in their late 30s and early to mid 40s for whom recognition of lip volume loss prompt them to come in for a consultation. They often tell me that they notice that their lips are looking smaller and their natural youthful pout is not as well defined. They also notice that their lips appear to have more lines as opposed to the smooth texture they once had. So why does this happen? This is due to the fact that the fat and soft tissue that provided the fullness of younger lips actually diminishes with age, oftentimes before changes in the skin and soft tissue occurs. For people who are in their mid-40s and older, it's often very clear that there is loss of youthful fullness as well as the unwelcome appearance of fine lines and wrinkles around the lips. One of the changes people notice with their lips is they don't have the same surface area they once had when applying a lipstick. Some people try to camouflage the loss of lip volume by applying lipstick outside the lip border so the lips appear larger. This can be noticeable and be distracting. Very often these patients are very concerned that they will look overdone and have so-called duck lips if they have a procedure. I explain that the goal is not to try to restore lip volume to what it was in younger years, as this would result in a disproportionate appearance. I explain we're aiming for a rehydrated appearance of their lips so they look fuller and naturally more defined. So, what is it like to have a lip filler procedure at our office? Like many things in the aesthetic field, people often form their opinions based on the experience their friends who've had a procedure similarly may have had, or they've seen demonstrations on TV and social media. I explain to my patients that the techniques I've developed have evolved over years of experience performing lip augmentation long before hyaluronic acid fillers were introduced. I've placed acellular implants as well as fat grafting and other open surgical procedures prior to the introduction of hyaluronic acid fillers. I place filler for the lips using blunt cannulas instead of needles. With fewer entry points, patients can look pretty good immediately after the procedure and return to work. I routinely perform lip filler placement for my patients during their lunch hour. Many injectors on social media platforms will use needles and inject multiple times into the lips. In my opinion, this approach is more likely to cause bruising and significant swelling in comparison to my approach. Beyond minimizing any evidence of having had a procedure, age-related volume loss also affects the other areas around the mouth. These areas include the area of the corners of the mouth which are referred to as the mesolabial folds, also known as marionette lines. In the same general area, people often notice deepening of their nasolabial folds, also referred to as parentheses lines. In the spirit of balance and proportionality, it's important to address these areas when appropriate to help your lips look right. Most of my patients see me for lip enhancement expecting a natural appearance consistent with my personal aesthetic style for surgical and non-surgical procedures. At the same time, patients will say things like, I don't want big lips. I don't want to look like a duck before I begin their procedure. I assure them that although there are people who want a stereotypical, exaggerated look, and that there are more than a few practitioners who share their aesthetic, excessively large lips don't fit with my aesthetic point of view. I prefer a balanced, proportional, and natural aesthetic, where I use the golden ratio as a starting point when I perform volume enhancement in the face. The golden ratio is the proportion of 1 to 1.6. This golden ratio exists throughout nature, which, in my opinion, is why my patients often feel that their look after volume enhancement looks so natural. Specifically for the lips, this works out to be a proportion of about 1/3 of the volume in the top lip to 2/3 of the volume in the lower lip. This ratio is also subject to adjustment for different ethnicities, where natural may be more of a 1-to-1 ratio between the upper and their lower lips. It's common for people who are middle-aged to recognize lip volume loss, as well as volume loss in other areas of the face. I believe that lip enhancement is not about getting larger lips, but rather restoring the volume that was closer to your younger self, while still maintaining balanced proportions for a natural look. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.